Right now, if you're a mental health professional, you have about a 20 to 50% chance that one of your patients is going to die by suicide during your career.
These are lives at risk. They're at risk every day, from moment to moment.
Suicide rates are only increasing. Things are only getting worse in terms of mental health issues. And so we need a better solution, frankly, just to save people's lives.
Despite decades of research on suicide, I and Mike and the rest of the psychiatrists really have no idea who's going to commit suicide and who's not. Until we can do a better job at that, and until we can get some idea of how to predict suicide, then there's really very little impact we could have on preventing suicide.
So I think the biggest role for me as the CEO of a psychiatric hospital, the Menninger Clinic, is patient safety is our number one concern. And to have patients that are continually at risk of suicide and constantly thinking about how we can keep them safe is, to me, the biggest challenge.
Well, most patients actually will have the decision to make a suicide attempt and then make the suicide attempt 10 minutes later. So it's just within minutes, the moment they make the decision to do it and then the act of it. It's extremely difficult to intervene in 10 minutes.
So our goal is to predict acute changes in suicide risk from wearable-based data. There is no solution like this now, and our goal is to develop that by testing it on our inpatients.
Research on the prevention and assessment and treatment of suicide has never been better, but the rates continue to go up every year across all age groups. And so we've really got to be innovative and creative about how to get at this. So with wearables, we're going to have access to people's internal changes, their own experience moment to moment, and help them understand when their suicidality risk is changing.
The information that we have now about the physiological response and what the body shows us and what it demonstrates during the increased thoughts of suicide, we've got to be able to tap into that. Wearables are the way that we're going to be able to monitor, we're going to be able to tweak, we're going to be more agile, I think, with our approach to suicide prevention.
We can start to develop personalized prediction of acute suicide risk changes. Right now, we have a really poor sense of that. What correlates with a high temporal resolution to suicide risk? Right now, it's kind of a guessing game. It's a guessing game for nurses, clinicians, school staff. Everyone's just, is that person safe?
To understand and to be able to realize patterns in your behavior in your life can be very empowering for people. That's what therapy is. It's to change patterns of behavior to make you healthier. And so the more information you can have about patterns of behavior, the better your interventions can be.
In person, they may not talk about some of the things they're struggling with, but sometimes answering the questions on a piece of paper or pushing my wearables technology doesn't feel as scary as actually saying the words to a person.
Wearables show us what's happening in the body. They give us a data-driven, evidence-based representation of what's really going on. Because once we know what's really going on, we can help people.
If you have a wearable and people can, I'm feeling anxious right now, and then they could maybe push a button and then they go and see their doctor and they're like, here's all the times you push the button and look at that, your heart rate was in the 140s every single time. It helps reinforce the connection that the body and the mind are connected. They both influence each other. It's not mental health, it's health, period.
Because it's not just all in your head.
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 Because it's not just all in your head.